Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Keratoprosthesis. Keratoprosthesis is an artificial corneal implant this is an artificial corneal implant. It is used in patients who are not suitable for keratoplasty. In whom the keratoplasty is contraindicated or cannot be done, in them we can use this keratoprosthesis. These are indicated in bilateral blindness from a severe or inactive disease. Whenever there is bilateral blindness, in them we can do this keratoprosthesis with no chance of success with keratoplasty, which is they are unsuitable for keratoplasty. So it can be done in conditions like it can be done in conditions like Steven-Johnson syndrome, ocular cicatricial pemphigoid, chemical burns, and trachoma. So, keratoprosthesis can be done in Steven-Johnson syndrome, ocular cicatricial pemphigoid, and chemical burns and trachoma. So, we have two types of prosthesis are available. One we have this is the Boston's prosthesis. So this prosthesis is called as Boston's keratoprosthesis. Second, we have osteoodontokeratoprosthesis. This is osteoodontokeratoprosthesis is the second one. So this is keratoprosthesis. It is mainly done in conditions where the keratoplasty is not possible and there is severe disease.
thank you and thank you for watching.